In the US, every 40 seconds, one person dies from a heart attack. Every 4 minutes, somebody dies from a stroke. And these are numbers that are established even before the COVID-19 pandemic started. During the height of the vaccination season here earlier in the first part of this year, let's say a senior went and got a COVID-19 shot, and then they went home and they happened to be among one of these people who every 40 seconds had a heart attack or every 4 minutes had a stroke. Within the first few days or even the same day after vaccination or hours within that time frame, I hope you can imagine, and I'm sure you do, how easy it would be to blame the vaccine for that outcome. I also hope that you see that there could be a true but no causal relationship between the two. And I'm not saying here, please understand, I'm not making the case that there's absolutely no relationship between the two. We do have the temporal association. One comes after the other. So it's in our nature to think that there is a relationship, a causal relationship. You know, cause and effect works that way. You have an event, and shortly afterwards, you have the second event. And so our reflex is to attribute the second one to the first. My appeal to your rational side is that there is a case to be made, knowing that these things were happening before we started the immunization, that they could be a coincidence. And my challenge to you today that I want to try to answer is, how do we tease those things apart? And this is the topic for today for the next 5 or 10 minutes. I'm Dr. Ionescu. My purpose on this channel is to help you make sense of health information and issues related to COVID specifically during this time. I'm not giving personal medical advice, as I'm sure you know by now. So let's dive straight into it. One of the ways to answer this question can be found in this article. It was published last month in JAMA, the Journal of Medical, the American Medical Association. I think it's a much better way to look at answers this way than to listen to our emotional side, because we had a person that told us they had this event happen to them, or because I had somebody who works for workers' comp, somebody told me yesterday in a comment, which I appreciate, that told them that they had to open this whole new department to deal with complaints about side effects from the vaccine. I'm not saying that's not true, but you know, hearsay is one thing, data is a totally different thing, and that's why I like to look at data. And this data comes from a study that has been done over the course of December of 2020 through June of 2021. This is where the bulk of vaccination, at least before the booster that is being given now, happened with the mRNA vaccines, the Pfizer and Moderna, here in the United States. They had a study group comprised of a little bit over 6 million people, patients, adults, that were part of one of these large healthcare groups here in the United States. Kaiser Permanente was one of them, and a few others in the Denver area and some other place in the US. And what they did, the researchers, their methodology consisted of starting to follow these people shortly after they got vaccinated, checking to see what happens to them. And the way they try to tease these things out as far as what side effects happen to who, they compare the people who received their first dose or second dose of the vaccine. They follow them closely for 21 days, for 3 weeks after each dose of the vaccination. And as you imagine, as I just said, heart attacks, strokes, and a bunch of other health issues happen to people regardless anyways. So what they did, they counted a number of these events, we'll talk about them in a moment here, for all those 3 weeks. And then they compared the frequency, the count of each of those events with what happened between day 22 and 42 after the immunization, with the idea that if somebody's going to have a side effect from the vaccine, it's much more likely to happen in the first few days or first 3 weeks after the vaccine, each dose, whether it was the first or the second, rather than after that. Now, a delay effect can still happen. So to account for that, they also compared with people who were not vaccinated at all to see, do we see a difference there? So I think it's a pretty solid methodology. You can look into the article. I'll post the link in the description below so you can read the whole thing if you want it. They followed about 23 health outcomes. Basically, they looked at a number of health issues, 23 primarily, and 4 others that they look for a longer time. These 23 that are the top of the list here, they follow for those 3 weeks after each dose. And the reason they settle on these is, number one, because there were some concerns in the literature up to that point that these things could happen. Concerns about what happens when people get COVID. If people who get COVID develop acute respiratory distress syndrome, there is a biologically viable possibility that some of the people who get the vaccine may develop the same condition, and they would follow that. And also side effects or events that happened during those clinical phase trials early on before the vaccine was approved, they included those things here, like you see, for example, Guillain-Barré was one of those. They also looked at some exotic condition, Kawasaki disease, but importantly, I said in the beginning, heart attacks and strokes. If you are curious whether those were included here, here is the heart attack, here are the strokes, both hemorrhagic and ischemic. So, and some autoimmune issues here, you know, that people are concerned when it comes to these vaccines in particular, and vaccines in general. And so they looked at all those things in this population, over 6 million people, like I said, and compared the frequency of these events in the 3 weeks right after vaccination with the weeks afterwards and people who were not vaccinated. So what did they find? This is the big question and the most important part of this presentation. What they found is that they counted the events, and you have here for each of these events, you see how many events they noticed during those first 3 weeks in all this population. And then they did a process of statistical analysis to see whether these events were statistically different or significant in the vaccinated group compared to those who were vaccinated for longer than 3 weeks or those who were not vaccinated. And they used a so-called p-value. Now, normally in a study, you use a p-value lower than 0.05 to be statistically significant. But in this study, interestingly, because they follow these people for 3 weeks, but the study is going to run for a total of 2 years, they adjusted the p-value for those 3 weeks to the total interval they are going to do the study. These are preliminary results, so you have to take this with that grain of salt. In 2 years, when they finish this thing, or a year and a half now, we will look at this again and see if anything changed. But for that reason, they have changed the threshold for statistical significance from 0.05 to 0.0048. And that's where that number comes from. In any case, so far, this is preliminary, but again, it's been over half a year. When you see no here for each of these outcomes, that means there was no statistical significant difference between those groups. There's nothing there. In the sense that if you see an event, if you see a heart attack, if you see a stroke in one of those groups, you see about the same number in the other group. There is nothing really statistically different. And this is powerful. Again, we are looking at over 3% of the US population in this group. There are some rare conditions, I should say that in that context, that happen, say, once in, a million. So if you have only 6 million, then yeah, your statistical power is not great, but by the same token, the probability of those events happening on a large scale is not there, because if you have 1 in a million chance of developing something, it's 1 in a million. It's not like 1 in 10. You see what I'm saying? So anyways, here, basically everything is a no. There is no statistically significant difference. And this is very reassuring for anybody who's sincerely wondering, what risk am I exposing myself if I get this vaccine? This is very reassuring. Again, I'm not saying there's nothing there, or in 2 years, in a year and a half, when they finish this study, there may be something there. But so far, we don't see much there. So when you read stuff on the comments on this channel and everywhere else in the internet, on Facebook, when the anti-vaccination activists come and scare you with, there's all this, adverse events and everybody's dying left and right from this and that and everything else, please understand that those things are made up. I don't see any evidence of them, either here or in my own practice. I'm a practicing physician. I have, around 1,000 people, say, under my care who have been vaccinated in this last year. I have yet to see something significant other than temporary pain, a little fever, a little achiness. And again, I don't say that these things don't ever happen. They do. And this is what I want to present here next. And that is the only significant things that they noticed, which we already know from other studies, and this confirmed it. that there is a chance, a small chance, in the younger age group, in the teenage group, especially in males, of people developing myocarditis and pericarditis. The risk is not great. It's about an excess of 6.3, I believe, cases in the young group per million people. But it's there, it's real, we have to keep that in mind. I have made videos on this in the past. I've also discussed the fact that COVID itself, the COVID infection in young people, there have been studies here in the US and elsewhere in the college age population among athletes that have gotten COVID before the vaccine was available. And we have seen a fairly large proportion, comparatively speaking, to the vaccinated ones, of myocarditis from the COVID infection. According to some numbers I've seen, the risk is about 30 times higher to get myocarditis from the COVID infection than you would from the vaccination. There is a risk there, but you have always to put it in perspective. Somebody may wonder, watching this, how come they haven't looked at deaths? Well, for one thing, they did. The other thing that they've seen that was statistically significant, I forgot to mention, is anaphylaxis. That outcome they follow for the first day after vaccination for obvious reasons, because if you're going to have an allergy that's so severe that gives you anaphylaxis, it's going to happen, 90% almost happens within half an hour of giving the vaccine. So for that reason, they follow it for a day. And they have seen an excess reaction in that sort for these vaccines, as we already knew from before. About death, why didn't they look at death as an outcome? Well, indirectly they have, for the simple fact that there was no statistically significant difference. So whoever died from a heart attack died both in the vaccine group and in the comparison group at the same rate. So for that reason, we cannot attribute to the vaccine alone some of these deaths. So indirectly, death was an outcome that they followed. But anyway, let me know what your thoughts on this are, and any other topics of interest that you think I should address. I'll be happy to do that. Till then, you stay safe, you stay healthy, and stay wise.